Make sure my mic is loud and my production is live and direct. Plant this first ball like a seed, my birth will grow from it. Like it's peaks and valleys, I flow for the summit. And know if I plummet, I'll go.
Welcome to all of you watching us live on Facebook. This is Colorado Healthcare 360, a special healthcare worker town hall event. My name is Patricia Johnson Gibson, contract specialist at Kaiser Permanente and Vice President of Healthcare at SEIU Local 105. This event is brought to you by Service Employee International Union Local 105, the largest union of healthcare workers in the state of Colorado, and Colorado Care Workers United, a growing group of care workers in our state fighting for industry-wide improvements for those providing care and those receiving it. Over the next hour of our program, we will be hearing directly from frontline healthcare workers who will be sharing their real experiences on the job during this pandemic. Dive into real solutions for how we can fix our broken healthcare system and discuss how to build power in our workplaces as healthcare workers. I'm excited to announce that we will be joined by several special guests, 3 local elected leaders in our state and healthcare workers themselves. Representative Emily Sirota, Representative Monica Duran, and Representative Kyle Malika. For the first half hour of this town hall, our special guests will be asking a series of questions to our healthcare worker panelists, Erin, Amanda, and Maria. For the second half, we will be flipping the script as we hear our healthcare worker panelists ask important questions to our special guest elected leaders. Throughout Facebook Live, we want to hear from you. Do your work in healthcare, have questions or stories to share. Post it in comment section below, and we will be reading them throughout our program. Now, before we get started, it's important to remember a simple fact. We will never bring real changes to healthcare workers unless we take action and demand better. They keep calling all of us heroes, but we sure aren't being treated like heroes should be treated. Heroes don't get their pay cut. Heroes don't get their hours cut. They don't get laid off, and they sure don't get fired when they speak out to protect themselves, their patients, and their families. Instead of calling us heroes, how about they give us PPE and pay sick leave? How they actually treat us how about they actually treat us with respect and dignity? But they aren't going to do any of this unless we all come together and demand it. We have to stand united. United we stand, divided we fall. So while you're watching, click on the following link in our comment section below, bit.ly Healthcare 360. Again, bit.ly/Healthcare360 to sign our online petition demanding better working conditions for all healthcare workers in our state. All right, onto the town hall. Kicking off, our first question from elected leaders is Representative Emily Sirota. Emily?
Hi, thanks so much, Pat. I'm Emily Sirota, State Representative for House District 9 in Southeast Denver and unincorporated Arapahoe County. And our first question to kick off this conversation is to find out a little more about our frontline healthcare workers. To all of you, what inspired you to start working in healthcare? Let's start with you, Amanda.
Thanks, Emily. My name is Amanda Martin. I am a health center assistant in Planned Parenthood of the Rocky Mountains. I didn't know I actually wanted a career in healthcare until I started working at Planned Parenthood. I started out actually as a volunteer at one of our Denver clinics, and financial means allowed me to volunteer during the day, but it didn't actually provide me with any healthcare where I was working at the time, and I made too much to qualify for Medicaid. So during that time, I needed to get a long-acting birth control method removed, but I was really concerned about the cost because those things aren't exactly cheap. And so one day I was talking to one of the health center assistants about state family planning funds, and she said that if I worked at Planned Parenthood, I would have great health insurance. She encouraged me to talk with the manager that day, and I was hired shortly after. Now I've been working for the agency for almost 8 years, and I just finished classes that I need in order to apply to a physician's assistant program in Colorado. So I'm really excited and feel really lucky to work in healthcare.
Thank you so much for that, Amanda. Maria, can we hear from you?
Hi, yes, my name is Maria Fenwick, and I'm a workplace safety consultant at Kaiser Permanente for the last 26 years. I work in the Denver regional office. I have many family members who actually work in healthcare, but I was originally inspired to work in healthcare by my mom, who's an emergency room nurse for the last 44 years. She actually retired about 5 years ago, and that lasted about 3 months. She missed being by the bedside so much. But I originally wanted to be a nurse, and my mom actually told me I would suck at it. So I decided to start off my healthcare career as a pharmacy tech, and then I moved into medical claims processing. In the last 10 years, I've been doing safety consulting work, working with healthcare workers when they've had an accident at work and trying to make their workplaces safer. So there's absolutely nothing more satisfying in healthcare than coming together and helping a worker when they've been injured on the job and making them feel safer, whether that's psychologically or physically, and going back to work. So it really is just wonderful work. So with that, I will kick it over to Erin.
Hi, my name is Erin Mcintosh, and I'm a rapid response nurse at Riverside Community Hospital. My mom was also an emergency room nurse like you, Maria, and I always looked up to her, but ultimately what inspired me to be a nurse was when I was working as a radiology assistant. I remember I was wheeling back a patient to ultrasound, and she was pregnant and they had lost the baby's heart tones. The patient was crying, and at that time I grabbed a warm blanket, I wrapped it around her, and I touched her hand. And I remember we shared a moment together. It was then that I realized how nursing would provide me with the unique ability to be able to connect with patients on an intimate level. I'm so passionate about nursing, and I do not regret for a second that I chose this career. And with that, I'm going to turn it over to you, Pat.
Thank you so much. Thank you all for those empowering and powerful stories. I want to remind all of you watching to join the conversation and do share your stories in our comment section below. I'd like to kick it over to Representative Kyle Mullica for our next question. Kyle?
Thank you so much, Pat. My name is Kyle Mullica, and I'm the representative for House District 34, which is in North Glen Thornton and Federal Heights, northern part of the suburbs of Denver, Colorado. I'm also an ER nurse, and so I understand a lot of the stories that I'm hearing and why people are getting into nursing. But this next question is a big one, and it's addressing the current realities for frontline healthcare workers. So to all of you, how has COVID-19 affected your work as a caregiver? What issues are you seeing in delivering care, and how are these different from what caregivers have been facing before the pandemic? We're going to start with Amanda again.
Thanks, Kyle. It's been quite a roller coaster at my clinic. We were limited in the services that we were able to provide, and almost all of our clinic staff lost hours. Having a union allowed us to have a voice in how hours were cut, and we were also able to save jobs that would have been lost if we had not bargained with management. Everyone's situation is different. Some folks may want more hours, some folks may have wanted to work less and reduce their exposure, and then we also had folks that were in the high-risk group and really just didn't want to be working at all. So we were able to provide folks with the choice in how they were working during this pandemic. At Planned Parenthood, the motto is care no matter what, and we continue to provide vital sexual and reproductive health services in Colorado, New Mexico, and Nevada. And I think the most difficult part during all this was the misinformation coming from the White House and conflicting info on how to keep our patients and our staff safe while we're figuring out how to continue to provide care. Things have improved since March, but there continue to be concerns about PPE supply lines all over the country. Essential workers are threatened with violence and have experienced violence for asking customers to wear masks. And we really need strong protections for essential workers, and we need elected officials that will stand up for science, for common sense and support all of our neighbors. I'm going to hand this over here to Maria next.
Thank you, Amanda. Maria?
Thanks, Amanda and Pat. We're also facing kind of the similar situations at Kaiser. However, we haven't experienced furloughs necessarily or too many reduction in hours. However, the way we deliver our care is certainly evolving in the virtual world for sure. The constant strain of our global supply chain and the availability of appropriate PPE for our frontline physicians and healthcare workers is a constant worry. In my job as a safety consultant, I do fit testing of N95 respirators, and just to see the worry on people's faces, our staff and physicians being put into unprecedented times where we're having to reuse N95, having to re-sterilize them, when prior to the COVID world, that just didn't happen. These were one and done supplies. We never had to reuse an N95. So that in of itself is very scary for folks. And our frontline staff is really worried about getting sick and coming home to their family and making sure that their family doesn't get sick. They're also worried about the quality of our PPE products. A lot of them are coming in from overseas, and they ask me oftentimes about, you know, what is the same quality standards? Are they the same quality standards? Is our government doing enough to ensure that a quality standard for our PPE is where it needs to be at? So it's emotionally exhausting for our workers, and unfortunately, we just haven't had the leadership that we need at the federal level, I believe, to stand up for healthcare workers and ensure that we get the protections we need.
Thank you so much, Maria. I'm going to pass it over to Erin.
Well, it sounds like it's kind of a common theme here, but you know, COVID-19 has definitely changed the workplace because it's a constant threat. It's a threat to my health, the health of my colleagues, my patients, and my family. It's an added stress that lingers in the back of my mind and results in the reduction of the quality of our care. 70+ employees at my hospital have fallen ill due to COVID, and one has died. The majority of these employees who tested positive weren't even from a COVID unit. They were from a non-COVID or a clean unit. And the lack of appropriate PPE as they were in a designated clean unit. I have colleagues that have moved into hotels and trailers and away from their families to avoid the possibility of their families getting sick. The risk that we're facing is not normal. It's a new challenge we are facing. It's our new reality. Unfortunately, the almighty dollar has led to poor decisions from the top, such as hoarding PPE. The use and reuse of PPE makes caring for these patients cumbersome. Can you imagine being given 3 gowns, having 5 patients with COVID-19, and being told to cluster your care? On top of that, your regular responsibilities, you're also drawing labs, doing EKGs, and helping doctors with their assessments as they're too afraid to go in these rooms. This leads to less quality time spent with lonely patients and more things being missed, and unfortunately, worse outcomes. I see this as a rapid response nurse responding to codes and emergencies, and feel that the system has set us all up for failure. That is the truth. We all leave work feeling like we're just not enough.
Thank you, Erin, for that. And thank all of you panelists. These are the real issues our local healthcare workers are facing. And we can do something about it, and we can do something about it right now. Visit this link and sign the petitions to demand better working conditions to all healthcare workers in our state. For our final question of our healthcare panelists, I'd like to kick it over to Representative Monica Duran. Monica?
Thank you, Pat. Yes, this is Representative Monica Duran. I represent House District 24, which is Wheat Ridge, Edgewater, and Golden. And my question is, the issues you just mentioned you know are now even more pressing at healthcare facilities where workers do not have a union. How has having a union helped you through this pandemic, and what can healthcare workers do to build power in the industry? And I'll kick this over to Amanda.
Thanks, Monica. Well, I'll say being able to have a voice on the job has made all the difference. You know, we're on the front lines and we know what we need to do our jobs and we know what we need to do to stay safe. Our input helps keep everyone safe in the clinic, and when we have issues, we feel like they really get addressed with management. And I'll say, you know, things are changing so fast, especially over the last 2 months. And knowing that the union has your back has empowered folks to stand up for their patients and stand up for their coworkers and themselves. And, you know, I mentioned the furloughs and preventing job losses, and giving people options and time to make these decisions that were best for their families really helped us navigate this pandemic. And still provide care in this environment. You know, when you see a dramatic decrease in revenue like so many businesses and nonprofits have over the last 2 months, the decisions that we made during effects bargaining were not easy at all, and they were a lot of work. We're a pretty new union. Our collective bargaining agreement was actually just signed in September, and I was on the first bargaining team, so I feel like I've been bargaining forever. But our bargaining team has really done a good job of getting protections in there for our staff, and also to help navigate the unforeseen dilemmas that have come out of the COVID pandemic. One of the things we really worked hard for was paid family leave in our first contract, but without state or federal programs, it wasn't going to be in the budget. And I really hope that this pandemic has shown our leaders how crucial it is to provide paid sick leave for all workers. And I really, truly believe that it needs to be a public option.
Thank you, Amanda. I'm going to ask for Maria.
Thanks, Pat, and thanks, Amanda, for that story at Planned Parenthood. I know you guys fought really hard. You know, at Kaiser, things are a little bit different in that we've been unionized for a couple generations. However, about 20 years ago, we wanted a bigger voice on the job at Kaiser Permanente. And so we formed what we call our Coalition of Kaiser Permanente Unions. And it's about 80,000 of us workers across all the states that Kaiser operates in, including here in Colorado. And during this COVID pandemic, what we've been able to secure with that bargaining power of, 75,000 other union members within Kaiser is paid childcare during this pandemic, paid administrative time off outside of our sick time if we were to get sick with COVID. We also are currently engaged with Kaiser. Every day we're on a phone call with upper leadership and management at Kaiser to talk about labor's voice, workers' voices in how we reopen safely so people are taken care of. How do we ensure that our patients are safe if they have to come in for a physical appointment versus a virtual appointment? How do we ensure that safety is at the foremost, top of the priority when it comes to PPE, when it comes to taking care of our patients, when it comes to appointment times, all those items that we are engaged in? Voice on the job is one of the best things we have as a union. I always think about my union contract as the Constitution at work. It's your freedom of speech. It's your due process rights. And so I am so very glad to have a union in my corner in healthcare. I think we would be in a lot of trouble without it.
Thank you, Maria, for sharing that story. And now we'd like to pass it over to Erin.
Maria, thank you for sharing that. Definitely, it is like the Constitution. It's something that we can always rely on. You know, just to piggyback off what you already said, the union brings the power back to the healthcare workers. It gives us a voice. We're the ones working on the front lines, and we know what we need. It gives us the power to be stronger in numbers. The more hospitals across the board that have unions, it not only standardizes our care as healthcare workers, but also the benefits that we receive. So the more unions we have, the stronger we're going to be.
Thank you, Erin. Thank all of you panelists. We've reached the halfway point of our program. I'd like to remind you all that are listening that we can build power for healthcare workers in our state right now by signing our online petition. Click on the link in the comments section, bit.ly/healthcare360 to demand better working conditions for all healthcare workers in our state. We've also been hearing from you in our comment section. Amy Skeet says, right now, all my unit is being forced to pack up 3 extra shifts every week. These are some of the most exhausting shifts I have worked. They ask us to give PTO accrual to the RNs that were furloughed, and then took massive bonuses the next week. Amy also talks about Denver Health is not paying for the hours that they promised. If the mandatory overtime shift is placed at the end of the week, we are not getting the same pay as people that work the shifts earlier in the week, because Denver Health has some old rule that would not allow double pay, even though even though there is an email saying that they would pay us a certain amount. That is totally unacceptable. And again, it speaks to the volume of why it's important to have unions in the nation. Ryan Brothers, he also spoke up. When we first started seeing COVID patients, it was nothing less than nuts. Not enough equipment, not the correct equipment, not to mention different answers of what was the right equipment to use. Ryan, we all hear that, and we continue to have to fight for our unions. We have to fight for unity. We have to let our voices be heard, and we have to stay united, and we have to stand together. And then we hear from Paula Coleman. Wow, I'm sorry to hear this story. Thank you for what you do. I'm also on the front lines in the lab. Kaiser won't take back PTO, so our members are having to take vacation time without pay. That's another issue that people are facing, and it's very concerning. Again, I ask people to continue to click on the links and put in their comment. Last but not least, we're hearing from Holly A. Herson. I'm an ophthalmic assistant in a private practice. We have been forced to work whatever hours we are told without any input from us as individuals, or risk losing our wage agreement that we were promised. It has been a nightmare, and we have had 3 people quit our clinic, so those of us who are left are abused and overworked. Private practice workers need to unionize. I am also the Democratic candidate of Colorado HD 48. I am definitely a union supporter. Thank you so much for that. It's important to hear. And now for the second half of our Healthcare 360, healthcare workers will be asking the question to our elected leaders. Amanda, go ahead and kick us off with your first question. But Amanda, before you say that, I want to go back and say, Paula Coleman says something very important. We all need to sign the petition. She signed it, and you all should too, to fight for stronger unions. Amanda?
Thanks, Pat, and thanks, Paula, for signing our petition. We really appreciate it. You've heard from us about how the issues we are facing to protect our communities, and now we'd like to hear answers from you, our representatives. In the response to COVID-19, our leaders at the federal level are failing our communities, especially low-end communities of color. And will you, as leaders in Colorado, be doing to address PPE, testing, and lack of sick leave for healthcare workers, where the federal government has let us down? I'd like to start with Representative Emily Sirota.
Thanks so much. I appreciate everybody's comments to this point in the evening, just showing what our healthcare workers are going through in our communities, and I'm so grateful for all that you are doing. You know, we know that our employer-based system of healthcare is collapsing as millions of people lose their jobs and are thrown off their plans. And we also know, as you noted, that the federal response on healthcare and the protection of jobs and our workers has been inadequate. I mean, we've seen the president fail to employ the Defense Production Act for essentials, for PPE, but he did decide to use it to send workers back into unsafe working environments in our meat packing plants. So it just it's an ongoing catastrophe, the lack of action that we've seen at the federal level. I will say that here on the state level, the Department of Labor and Employment has used emergency rulemaking to mandate paid sick leave in certain industries, including many classes of healthcare workers. The department's also hired a number of new caseworkers to help process the vast number of unemployment claims that we are seeing. Of course, much more needs to be done. There are several bills that are being worked on right now about what emergency legislation we will try to pass when session resumes next week. And worker safety is is one of our top priorities. But unfortunately, this lack of federal response has also left state budgets hanging as we face a $3.3 billion shortfall, which is causing cuts to every corner of government. And so we face a challenge in that we can't print money like the federal government. So we will be doing what we can to use some of the CARES Act dollars that came in some earlier COVID response from Congress, and that will be toward assisting workers. We're scaling up testing. So the governor has already laid out plans for how most of this money will be expended, and a significant amount is going toward increased testing and community tracing to try to isolate and do better in terms of keeping our communities safer. But yes, there is still a lot more to be done, and I encourage everyone to follow what happens at the legislature next week and continue to make your voices heard toward your elected officials about what you demand to see done, that you expect our state to do the best we can with what we have to ensure that we are protecting our most vulnerable communities and workers.
That was perfectly said, Emily, and thank you, Amanda, for the question. As an ER nurse myself, the day after we pushed the pause button down at the Capitol for session, I was back in the ER the next day, that Sunday. And so I've seen firsthand the effects of this lack of response from the federal government. I've seen the lack of PPE and the reuse of PPE, and just how it's completely unacceptable, and it's an unnecessary risk for our healthcare workers, and not just the nurses and the doctors, but those other frontline providers, our janitorial staff, we need to do a better job. And I think that's we're going to have a battle out in DC, but the things that we can do here in Colorado is to, make sure that these hospitals are being held accountable, making sure that they are prepared for if we do see a resurgence or another pandemic, to make sure that our healthcare workers are protected. We need to make sure that we are doing things around staffing to make sure that we have appropriate staffing. It's something that I've been working on offline without legislation around hospital staffing with their license. They're going through the process this year with the CDPHE on revamping their license process, and I've been working to make sure that staffing and staffing levels are a part of that, and that workers have the ability to report unsafe staffing environments so that these hospitals can be held accountable. And lastly, I think that we really need to work on making sure that that there's not this retaliation for when healthcare workers stand up and say something's wrong. We need to be able to speak up without fear of retaliation, because that's how we're going to get change, and that's how we're going to get recognized. And there's a huge fear of retaliation in the healthcare world, that nurses are afraid to say what's going on. We saw that with Denver Health. And that's just unacceptable. Nurses should be able to stand up and say, we don't have adequate PPE, or these are unsafe environments, or this is unfair, without the risk of losing their jobs. And so I think that's something that we need to be doing here in Colorado. We're working hard. We have good leadership here in Colorado. We actually had our House leadership when there wasn't enough PPE and we saw this coming down, actually hold a drive at Invesco Field to try to make sure that we were getting PPE in our healthcare workers' hands, because we weren't getting that response from Washington, D.C. And so we recognize it. We're ready for the fight. There's a lot of work to do, but we're going to make sure that moving forward, we're doing all that we can to protect these frontline workers.
Thank you, Kyle. I'm going to now pass the same question over to Monica Duran.
Thank you, Pat. I so agree with both of my colleagues, and thank you for everybody for sharing their stories. My background is 35 years in the dental field as a dental assistant, and I've been connected to the dental community over the last few months, and just hearing their concerns of going back and not having enough of the masks that they need, and how they're going to have to kind of try to recycle and do with what they have, to me it's just unacceptable. Everybody's putting their life at risk to take care of our families, to take care of us, that the least we can do is make sure that they have what they need. And just to reinforce the fact that, at the federal level, they're failing, not doing what needs to be done. But here in our state, with our legislature and my colleagues, we are standing strong and firm and fighting for our democratic values. And that includes making sure that we are protecting our healthcare workers. We are trying to do our best with making sure we have, and we're prepared, right? Not just for now, but in the future. This is going to be a long-lasting situation. We have to make sure that we're prepared with our PPE. I also saw where the governor has also implemented free COVID testing for anybody that has symptoms in 34 counties. So that is just awesome. So we need to make sure that we stay strong. We hear your voices. You keep speaking loud and clear, and call your legislators. Share, just like we're sharing right now out there, and letting everyone know, hey, we're here. Here's what we've been going through the last, 7 weeks. And we don't want to go through this the next 7 weeks, or 3 months, 4 months, 6 months. So I'm really proud to say that we've really fought hard. We've got a lot coming to the legislature starting next week. So as Representative Sirota said, just keep your ears and eyes peeled with the legislation that's coming to really stand up for our workers and for the state of Colorado.
Very good. Thank you, Representative Sirota, Representative Malika, and Representative Duran. I'm going to ask Maria to please present the second question.
Yeah, thank you, Representative, for your continuing actions to fight for us healthcare workers in our community. It's so important. And as a union member, my coworkers and I know being united is important now more than ever. There is nothing better than having a voice at work, but then also having all of our voices at work. We want a seat at the table, and it's a much better proposition for our community when we are able to have that voice at the table. I'd like to ask you guys, how will you as elected leaders protect the right for healthcare workers to have that voice on the job and to join together in a union? We'll start again with Representative Sirota.
Thank you. Appreciate that, Maria. I think, we, your panelists here agree about the need for strong unions, that collective voice from workers is essential in a workplace to ensure that that you are being listened to. I mean, you're the ones on the ground doing the work. You are seeing firsthand what's happening. You are seeing the gaps. You are, I think Amanda really did an excellent job earlier of outlining the impact she has seen in her workplace since they have been able to form a union, in terms of creating that flexibility, understanding that workers are have different needs, and how can they create that flexibility in the workplace to meet everyone's needs while still doing what needs to be done. So I think that's critical. I think one of the most recent actions that we have taken, Representative Mullica, Representative Duran, and myself, has been to stand behind the organizing effort of our Denver health workers, who are now engaging in an organizing effort to form a union. And we all signed a letter and wanted to communicate very clearly to the board and the executives at Denver Health that we believe in the right of these workers to organize, and we expect them to allow that effort to go forward, not to engage in union busting tactics, and we will continue to speak as a voice on behalf of those workers to make sure that these executives at Denver Health know that we are watching, that we are paying attention, and we expect these workers to be treated with respect and dignity as they work to elevate their voice.
Thank you, Representative Sirota. Representative Mullica.
Thank you. And I think the importance of unions, is that unified voice. It's that solidarity that, doesn't allow you to get picked off, and you stand together, for one cause, and that's to make sure that you're able to be treated fairly. And that's the big thing with unions that I think gets misconstrued, or that people try to misconstrue, is that unions just want that seat at the table, and they just, union members just want that seat at the table and want to be treated fairly. And there is nothing wrong with that. And that's how employees should be treated. And that's what we want to fight for down at the Capitol. We want to make sure that people have the right to organize if they choose to. And that we need to continue to fight to make sure that we're not losing these rights that we've gained here in Colorado, because they are under constant attack down at the Capitol, and we constantly have to battle to make sure that we're not going backwards and that we're still trying to go forwards. And there's a lot of things with organizing and with unions that need to be done at the federal level, but there's still things that are in our tool belt here at the local level in Colorado that we can do. And I spoke about it a little bit before, but we need to make sure that that we start focusing on this retaliation piece, in my opinion, because we see it happening. We see it happening at Denver Health right now, that they they're getting emails that they need to be ready for furloughs and to take pay cuts, and the next day those executives receive their bonuses. Yet they're afraid to speak up about it. They're afraid to speak up about the union because of retaliation, and that's completely unacceptable. And so we need to make sure that our workers are being protected, that they can speak up against what's happening, against any wrongs that are happening against them. I think that's a big step that we can take here in the state of Colorado, while continuing to fight to make sure that we don't lose any ground, which, like I said, our colleagues on the other side of the aisle continually try to attack and try to make sure that we lose any ground that we've gained.
Thank you so much, Representative Mullica. Representative Duran.
Oh, thank you so much. It's no surprise. I come from a long line of migrant farm workers. And as a child, of course, I didn't understand the impact until I grew up, that my family was fighting for fair wages, better working conditions, and the right to unionize when they were marching with Cesar Chavez and Dolores Huerta. So, you know what? We've been fighting for decades, right, to make sure that we're treated fairly, our voices are heard, and frankly, that we have a seat at the table. And we need to continue fighting for those things. That is in my blood, and it always has been and always will be. And I'm really proud to say that here in Colorado and with our colleagues, we're standing up for that. We're standing up to make sure that you have a seat at the table, that your jobs are protected. Unions are diverse. Unions offer work safety situations, right? They're safer places to work. They're your voice. They stand up for you, and you should not be afraid to stand up to your employer at any time, at any place, to say, listen, I'm feeling concerned about this. You know what? I'm due for a raise. Or what about my vacation time? That's ridiculous. So I'm here with you, and we will keep standing up and fighting for you. And retaliation is unacceptable and won't be tolerated, and I won't tolerate it. And someone had mentioned paid family medical leave. That's extremely important. I support the public option, always have supported the public option. You know, there's a ballot question, hopefully that will be coming in November for state-run paid family medical leave. I support it. I'll be advocating and fighting for it. And I know all of you will be too.
Thank you so much to all of our representatives. I am now going to turn this over to Erin for our final question of the evening. Erin?
Hi, yes. Thank you all for your commitment to stand with us. We really, truly appreciate it. To finish up, we wanted to round out the conversation with some examples of inspiration and hope for this difficult time. And this will be a question for everyone. What has been the most impactful moment of solidarity you have seen during the pandemic? And we'll go ahead and start with you, Representative Sirota.
Thanks so much. You know, we've actually, I think I've seen a number of inspirational moments throughout these last months, but maybe I'll give a little shout out to the work of my colleague, Representative Mullica, who spent weeks working as a nurse on the front lines in Cook County, tirelessly helping people across really long shifts, working 12 hours a day, 7 days a week for 5 weeks, which is just an incredible commitment to the community. And I think it's really inspiring. And he did that while he was, while he's been working on legislation to help our state when we come back next week. And so I just want to say thanks, Kyle. And he's going to be, he is an incredible and invaluable voice crafting legislation to respond to COVID. So we're really grateful and lucky to have you.
Thank you so much for sharing. Representative Mullica?
Thank you, and thank you, Emily. That means a lot to me. I would say one of the things that really sticks in my mind is, like I said, the day after we paused at the session, I went back and started working in the ER. And the thing that people, you know, don't understand, you don't become a nurse because you want to get rich. You become a nurse because you care about people and you want to help people in their most difficult times. And I can still see walking in and my colleagues on, you know, the look on their face. And the thing that I love about the ER is the camaraderie, that we're all in it together to make sure that we have those positive outcomes for our patient. And you can see the fear in their eyes, the unknown. This was still relatively early on. We didn't have adequate PPE. We didn't really know what we were dealing with. And yet they were still there. They were still there, and they were still running into the room when that call was happening or when that emergency was happening. And that was so inspiring to me because they have families at home too. And they want to get home to their families just as much as anyone else does. But they were there doing their job, you know, facing this fear head on. And it's just this, I mean, it's hard to even put into words, just, you know, to see what these people were doing, and that they and how inspiring it was for me, and how it drove me to want to work harder to make sure that they were protected, because, you know, what I was seeing was just so unacceptable. And that we need to make sure that, you know, if we're going to say that these people are heroes and we're going to, you know, put out Facebook messages and commercials, we need to treat them that way. And we need to make sure that we're doing all that we can to make sure that they can get home to their families too. Because the way that they're currently being treated is just not right. And so, but it was incredibly inspiring, and I'm so thankful to be able to work with the individuals that I've been able to work with during this pandemic.
Thank you so very much for sharing that, Representative Mullica. Representative Duran, can we hear from you?
Yes, thank you so much. I couldn't agree with Representative Sirota's comments on my colleague, Representative Mullica. Thank you. Thank you for your sacrifices and your family, because they had to go through this with you. So grateful for that. I think for me, there's so many things that I could say that stood out for me. But I think one of the things I'll mention is probably my community. You know, different stories I've heard of neighbors who you wouldn't otherwise think would pay attention to what's going on to their neighbor next door or across the street. And one story that I heard early on was a neighbor who went outside and he noticed that his neighbor, who's 83 years old across the street, had left his slippers out on the porch. And it dawned on him that, that was just unusual that he would do something like that. So he thought, I better go over and check on him. And went over, checked on him, and apparently he had fallen in the kitchen and had been there for a couple days. And he called, obviously 911, got him the care that he needed. But I just heard so many stories like this of neighbors who were helping neighbors, whether it was getting groceries for them or just checking in on them to say, are you okay? You don't see each other any other time, but for some reason, especially with this pandemic, it brought out the best in people, and just caring for their neighbors and their needs and if they needed anything. And it's still continuing now, just to make sure they're okay, their kids are okay, if they need anything, calling to check to say, hey, you need anything from the grocery store? Do you need your medication? So I think just really showing in such a time of stress and such a time of uncertainty for all of us that we still are united and still loved and cared about each other to check to see how we're doing. And that's something that really kind of sticks with me and will continue to stick with me.
Thank you so much, Representatives. Just hearing the stories of solidarity during this pandemic is moving and heartfelt. And with that being said, I'm now going to ask the panelists to share their stories. So I'm going to pass it over to you, Amanda.
Thanks so much, Pat. And I also want to thank our representatives for joining with us in this conversation. One of the things that I've been following is also the Denver Health employees looking to organize those huge bonuses that top officials got and in healthcare, not just at Denver Health, but all over the country, faced with then healthcare workers not having their needs met is just reprehensible. And the folks that I've met working in healthcare are some of the smartest, most passionate, and amazing human beings that I've ever had the pleasure of working with. And I really hope that folks that are out there right now working in healthcare and are not represented by a union will feel empowered to give a union a call, to start talking to their coworkers, because they really can make change. And when things are so stressful and crazy like they are right now, we really have a unique opportunity to build something bigger and better. When we were doing our organizing drive initially to start our union, both elected leaders and folks that were running for office were absolutely instrumental. And so those folks that are at Denver Health right now thinking about unionizing, I really encourage you to go for it. Go for it right now. You have the support of legislatures and you can make incredible changes for such a great resource like Denver Health. So I hope that they're able to accomplish what they're looking for.
Thank you so much for sharing that. Let me pass this over to Maria.
Thanks, Pat. Like everybody else mentioned, just the coming together of community and families and looking out for our neighbors has just been absolutely incredible. When I think closer to work, I think about the very first days of this pandemic and where PPE was being confiscated so we could count how much was there. Do we really have the appropriate PPE? And it really caused a panic within our buildings at Kaiser. And what happened was we came together as union members and had sewing parties to make cloth masks. Not only for ourselves, but for our patients too. And even now, continuing today, a couple months later, we have patients come in and drop off cloth masks for whoever may need them. And I think about how we as union members came together during a scary time, not knowing how much PPE there would be. We still don't know how much PPE there is out there, really. And so it reminds me, being in a union reminds me of family. Yeah, even in the union, we call each other brothers and sisters. And there's a reason for that, because we really do feel like a family and we take care of each other. in every possible way that we can. And so I am so thankful to have my union and my fellow union brothers and sisters. And thank you to our elected representatives for your advocacy work on behalf of us. And we will help you with whatever you need as well. But just the coming together for one great cause is really just inspiring. And I hope we can continue to make great waves doing it.
Maria, thank you so much for sharing that. I couldn't agree with you more. With that being said, can we now speak to Erin?
Wow, that was such a great story. I feel the same way when it comes to my union. We had a similar experience with PPE, just like you were saying, Amanda. They were locking up our N95s, and so they were, kind of hoarding them, and employees were falling sick. So our union organized, and we had a silent protest. And because of this silent protest, we created a force of solidarity and an outpouring from the community, and we involved the media. So by the next day, rest assured, every single one of us received an N95, including every level, even our EVS workers. So for me, that was a moment that really told me that the union was super important and showed us solidarity.
Thank you, Erin, so much for your story. Well, I think the conversation we have heard here tonight is a perfect example of the solidarity and unity we all need to grow during this pandemic and beyond. We cannot let it stop here. I want to thank all of our panelists for sharing their stories and solutions to the real issues healthcare workers are facing. And this conversation is just the beginning. What can you do to be a part of the movement right now is signing the petition at this link to stand with healthcare workers across our state, ready to better our industries and workplaces. Also, be sure to follow the SEIU Local 105 on Facebook for the latest news and information about the future events like this one, training opportunities, and more ways that we can take action. I would like to just give a few final comments for our viewers before closing out for the evening. Alicia and Karen Garcia Velasco, home care worker, says, I have been working nonstop and even have added homes to my route due to the company losing a lot of staff. I have been one of the ones drawing labs for most of our COVID patients and have not been compensated. Again, a reason why we have to fight for a union and solidarity to stand up against issues that this young lady is advocating for now. Evelyn Castillo, my facility has 20 patients in the rehab unit and only 2 CNAs and 1 nurse. Totally unacceptable. Again, we're speaking about solidarity, unity, and getting to a place where unions can stand together with our representatives and fight for the better of the healthcare and healthcare workers that are standing on the front line. Amy Skis talks about when COVID started, they made an incident command center at my hospital. I personally offered to come in on an off day, unpaid, to represent nursing. It is only represented by upper management. Again, their voices, the frontline staff voices, are not being heard. We have to let our voices be heard. And last but not least, Monique Nicole Hernandez says, with the union, I feel more united with my coworkers than ever before because your voice is being heard, Monique. Now we'll end with this. We pulled through by pulling together like we have done in the past. This means demanding resources, pay, and protection for healthcare workers across our country. As a united force, we can demand our local, state, and national governments to do everything possible to protect everyone's health, no exceptions to the rule. And together we will win. This wraps up our program. Thank you for watching and stay tuned to our Facebook page for more information on Next Colorado Healthcare 360. Good night and thank you for joining.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.